Dear ladies and gentlemen, I would like to present you our Russian project. It's called ONCOREHAB. It's online digital service for remote monitoring, telerehabilitation, and educational support of oncological patients during anti-cancer treatment. And first of all, I would like to thank all my Russian colleagues. As far as you know, the COVID pandemic changed our daily lives, adapting to distancing, restrictions, and varying degrees of isolating at home. People with cancer are commonly immunocompromised while receiving treatment and may be twice as likely to test positive for COVID and have higher morbidity and mortality. Evidence from randomized controlled trials suggests special exercises according to the nosologie in physical functioning during and after anticancer therapies. The practical impossibility during pandemic to get physical rehabilitation as an important part of a treatment determines the highest risk for this group of patients. Thus, the relevance of physical rehabilitation for this patient in isolation increases many times. So, our goal was to create and implement in a pilot project a digital service, ONCOREHAB system for telerehabilitation, remote monitoring, and educational support of cancer patients outside the hospital. So what is ONCOREHAB? It's a developed platform, is a closed cloud service hosted in a data processing center, which provides healthcare organization with a ready-made service for online rehabilitation, training, and group for cancer patients. The real-time video streaming communication is used to deliver rehabilitation service to the groups of patients according to the type of the cancer and the stage of the cancer. Each training session is supervised by a physician using online video conference communication from the Center of Oncological Rehabilitation Department many times. So, ONCOREHAB technology platform is a four-role system. It's administrator, it's clinical oncologist, physician, and a patient. So, of course, the main role of it is a physician, but the administrator edits stages and format the classes, so he makes a schedule, and the physician conducts the session according to a schedule. Each schedule is according to the nosology or to the state of the nosology, of the oncological nosology. So this is our ONCOREHAB tools. Control questionnaires for each nosology: breast, lung, urological, gynecological, colorectal cancer, and onco-orthopedic. Based on the primary and final questionnaires, it's quite possible with the help of artificial intellect to evaluate the effectiveness of rehabilitation measures such as general symptoms, limb and wound control, pain control, control of telerehabilitation tolerance. So this is our timetable. Look at the picture below. Here on the left corner up, it's real women who are offline. They are lying in hospital. They are still on cure and they're making gymnastics together with a doctor. The rest women are staying at home after the operation, after the hospital. And I didn't expect that this group would be such a group of psychological support of each other, because really each day, each group, the women are very glad to see each other. And the fact that sometimes in the room of a woman who is calm, it's a running daughter or a child or a mom, it's making a fun for everyone. So back to tools, ONCOREHAB tools. Heat map, one of the most important elements of the system. It's analytical model which ensures the construction of heat map of a patient condition and ranking patient monitors by physician according to the severe of this urgency of necessary attention. Based on primary and final questionnaires, it's quite possible to analyze the effectiveness of rehabilitation measures, of course, with the help of artificial intellect. So, regularly, physician receives summary of all his patients on remote monitoring, ranked according to the overall complex severity of the symptoms noted by the patient. to reveal the most dangerous patients and make a decision about his further prolongation of the cure. He does it. A comprehensive assessment algorithm was developed by the authors, taking into account the weight of various symptoms indicated by the oncologist. And it's all also artificial intellect. But this is our educational courses. Video lesson for self-rehabilitation, because our classes is held on a working days. This is a home assignment for a weekend. So to support patients with different oncological nosologies, there are 4 nosology groups of exercises for all periods of anti-cancer treatment. Here you see a real cancer survivor patient, Natalia. She's a breast cancer patient, and she shows her friends how to do the exercise. And this makes them closer, and this makes them on equal level. So as well, there are 32 educational doctor expert video lectures of professor for physicians, basic rules and principle of oncological rehabilitation. We did it for the first time in Russia to show, to persuade the physician that rehabilitation for oncological patients must exist. They shouldn't be afraid of them. They should be relying on our election and our value-based principle of oncological rehabilitation. And this is another 32 educational expert video lessons for doctors, for the same physician who are working with oncological patients during the process of curement. This is dietotherapy and nutritive support of oncological patients. This course never existed because before it didn't start our OncoRehab program. Now all these courses are available for those who are working with oncological patients. And this is for our patients. It's called telenursing, a part of telenursing. It's educational leaflets for patients with advanced cancer and with advices, with booklets and the video exercises. So as far as you understand, on these leaflets, there are QR codes, and on each code, the patient, according to the nosology, can find information about his condition, about what is going on with him, which is support, how to eat, how to make gymnastics, and how to know much about his disease. It's the most important fact that all these materials were made with doctors. We were trying to adopt the doctor language to patient language. So it's in a very, very simple language, understandable for people without medical education. And plus, digital patient guidance to informed about the way of living and rehabilitation. Look at this, it's 8 nosologies, and it's also about target therapy and immunotherapy booklets. So it's telling the patient much more about their disease on an adopted patient language. And it's very, very important for them. And now about our study. To evaluate the effectiveness of OncoRehab system, 2 groups of patients were formed. Totally, there was 607 patients who had early post-surgery offline training while staying at hospital. All participants were breast cancer patients as post-surgeon period, regardless the types of the operation. It was breast cancer. So the OncoRehab group consisted of 306 patients, had 5 days a week, 4 weeks online, 30 minutes online training group supervised by specialists. And the control group of 301 patients was, of course, on usual care, received only leaflet flyer containing exercises and advices, which I showed you just before. So the fact that the treatment was often a group made it a lot easier for patients to cope with the treatment and the challenges alongside it. Look at these people. They are doing their exercises together. Those who are very sick and weak, lying in hospital, and those who are a little bit stronger being at home. They are watching each other, communicating with each other, and the doctor can ask a question. either a woman from a TV or a woman who is standing behind. So by the end of rehabilitation program, the respondent reminded very positive about the treatment. So this is the response which remained in the program, and I will read you just two of them. The main strength of the treatment was the group. If I had to do it only on my own, I would not have made such much progress, so much progress. And another one, yes, I really feel like I belong here, being in a group of 24 who are all have the same disease. And there a lot of experience that everyone knows. They know how it works and what is on your mind and what is inside. And that is tough. Wrote 47 years old female with a patient with breast cancer. And this cost immense, these words. It's the best. And this also cost immense because it's our results. It's not a lot of, but it's our results which showed significant improvement in compliance and shoulder mobility. They had less pain, fatigue, and anxiety, but hand grip and arm volume didn't alter much. Look at this. Look, 55% of difference in the intervention group. It's blue color, and control group in functional shoulder impairments. So orange is a control group. And then look at the pictures of anxiety and fatigue and pictures of anti-flexion shoulder. It shows that the distant rehabilitation can be also very, very impossible, can be positive and can be helpful for a patient after an operation. But we have to pay attention to the fact that this was doctor-controlled group. The patient were at home, and it was easier for them to come into these classes to do it more regularly. By the way, most of them started to do regular classes which they were taught in their future life. And now another group of patients. It's a group of patients with head and neck. And this patient can't communicate in group. This is individual rehabilitation. And so we did a lot of educational videos, how to take care about how to eat. And for those who are after laryngectomy, we were having online video classes with a logoped. And it was, can't tell you how important this is for these people who don't want to leave the house in the daytime. Another group which became, unfortunately, bigger and bigger is the patient with advanced cancer. 105 educational video lessons of home palliative care and remote pain management to the relatives. We did it with a nurse who, on a simple, very simple language and with a very pleasant voice, showed such tricks to people who must take care about their relatives who are slowly dying, slowly can't have no more power to take care about themselves, to take care about them tenderly, surely, and being happy to do what they are doing for their relative. So now a few words of what we did 15 months ago more. It's a module for post-COVID rehabilitation. It's a remote rehabilitation for the patient struggling with post-COVID syndrome. The treatment group patient who have shared the same medical background is often mentioned as a very positive feature of a treatment. Our answer to COVID challenge was to use OncoRehab as a COVID rehab platform. 2,600 patients had moderate and severe coronavirus pneumonia, were training in supervised group for 15 months, and they are training till now. 2,600 people. They are much more because the groups are still going on, and I can't imagine how long it will last. I thank all the doctors who participated on this project. I thank all my partners, and I tell you how important it was for these people after COVID with fears. Absolutely anxiety and absolutely having fatigue syndrome, to communicate to each other in this group, to look to each other, to see that one is much more weak than those who are nearby. And it was a real inspiration. That's what I tell you. Exercise support through the COVID-19 pandemic. Is telehealth an answer? Yes. Evidence suggests home-based exercise intervention may be less effective than directed supervised intervention, of course. But incorporating telehealth in home-based intervention design is one potential way to increase the level of interventional support. Remote rehabilitation and monitoring is a demand by cancer patients. This significantly improves the quality of life, certification with the treatment, recommendation, and other things which we are having. So this is the slide about our scientific leaders. So you can write down our email and send us a letter as soon as you want. Thank you and bye-bye.